Number one, treating blood flow abnormalities. This is always number one on our list. So when an increase in physical exertion or an increase in heart rate itself increases symptoms. So to check for this, we do an incremental treadmill test. This starts with just flat walking. And then every minute we start to increase the grade by 1%. And basically we watch heart rate response and we see when do symptoms worsen. It's always one of the first things we check, because if we can rule it out, then we can promote unrestricted aerobic exercise. If we rule this out, then there's no reason to restrict exercise, and it's much better to be more active. And then on the other hand, if we do have findings, we put a quick formula in and we can prescribe aerobic training at a target heart rate. So either way, we're going to be exercising.
Yeah, no matter what.
Yeah. Usually that starts at about 80% of the provoking heart rate, and exercising for 20 minutes, 5-6 days a week. That depends on your overall fitness level and experience, but it's always around there. So it's usually more than people expect. But it usually feels good to get moving again.
Yep.
One thing that can't forget about is the effects of physical deconditioning. So a lot of chronic clients that we see, when we first meet them, they're actually in the worst shape of their life. So the first couple of workouts are pretty uncomfortable, but that's okay. That's normal. You're not used to being nauseated from a stationary bike, but you just haven't pushed your heart rate in a while. So we see that too.
All right. So that's number one. And then strategy number two is the reduction of inflammation. So like any other injury, there's always inflammation involved. Inflammation is a key process in the acute stages of a concussion injury, and it is necessary for healing, but any ongoing inflammation in your body can cause continued symptoms such as fatigue, headaches, fogginess, effects on your mood, sleep, etc. So the recent research does show that there is a feedback loop that occurs between our brain and our gut. We refer to this as a gut-brain axis. So following a concussion, microglia, cells in our brain, don't really need to go into detail on that.
It's cutting edge research.
Cutting edge. They are activated, and they actually play a pivotal role in that inflammation process that we need at the beginning of a concussion. But then these stay active much too long, and they actually send a lot of information to our gut. And this causes a structural change to our gut, where we essentially get leaky gut, something that you would have heard with people that have like Crohn's disease or have any allergens or allergies to anything. It causes leaky gut. So the concussion itself can cause this leaky gut. And then with that occurring, that then causes this systemic immune response that goes through your whole body, which then has an effect back on your brain again and promotes that inflammation in your brain. And it just keeps going in this feedback loop back and around, and it doesn't typically go away very easily. So this is another thing we kind of address right at the beginning. The first time we see you is we talk about a diet plan, because changing your diet can help reduce this inflammation and get your metabolism back to where it needs to be and get your gut back to being healthy. We will go into this diet plan a little bit further, because we do have it further down in the presentation, because we do have a handout we will give you that you could get started on your own.
Who here has noticed any weird stomach or gut things that you may or may not have attributed?
Especially with gluten too. That's one of the biggest ones. If you all of a sudden notice it bothers your stomach, or you feel really fatigued after you eat it.
Michelle did, yeah.
Awesome. Okay.
I think this is one in the past we just didn't know. Nobody knew to even explore it as related.
And even in the last 2 years, this research has changed so much and has brought a lot of light to how big of an involvement our diet does have on our concussion. Cool. Okay, let's keep going.
Number 3, vision and vestibular. So vision and vestibular dysfunction could mean different things for different people. Some people have trouble with eye movements or coordination. Other people have more balance issues or motion sensitivity. These are categorized together because the balance system in our brain takes both sets of information from our vision, what we see, and what our inner ear perceives as motion or position changes. And if that information doesn't add up, then it creates symptoms: dizziness, nausea, etc., imbalance. That's also quite fatiguing if these systems aren't working efficiently. It's like if our brain is a PC, a computer, and there are too many browser windows open all the time, and those are Internet Explorer windows.
No good. No good.
That should just be running smoothly in the background, right? It shouldn't be taking up all this extra energy. So to improve all of this, we seek out the simplest things we can find that somebody is not good at and start to train it specifically with exercises. These types of things you can train very frequently, and in isolation, they actually improve really fast. Yeah. Then it's a matter of putting it together into functional exercise related to whatever the activity goals are. So someone said earlier, like up and down with gardening was a provoking thing. Just those simple head motions might be something to work on at first, and then start to build on that.
The same actually goes for screens too, and reading. Like your scanning of a screen back and forth, that has so much to do with your eyes, and even your head moving a bit while your eyes are moving. Again, that's another thing that can be addressed through this treatment. All right, so concussion or whiplash. So you guys can see in this table here, in that big red box, there are very similar symptoms between concussion and whiplash. You can have whiplash without a concussion, but if you are diagnosed with a concussion, you will 100% of the time have experienced whiplash as well.
It just takes way more energy, way more acceleration to cause a concussion than it does to strain the muscles and joints of the neck.
It only takes about 4.5 G's of force to cause whiplash, but for concussion, it's about 70 to 80 G's of force. Okay, so this leads us into addressing neck health. So neck health is very important post-concussion, as your neck can not only just cause pain, but it is also a source of your headaches, dizziness, nausea, and even ringing in your ear. We have this reflex between our eyes and our neck. It's called the 𝗧𝗪𝗪𝗀𝗪 reflex. It's one of the fastest reflexes we have in our body. The muscle spindles in the muscle are very sensitive to any changes in movement. So if that muscle is too tight, or it's weak and not firing like it should, that will affect your eyes. That will also affect your eyes when you go to turn your head and cause dizziness. We do address this, and we can work on it through things like posture. We also work on the mobility and strength of your neck, which is usually done through a home exercise program. And of course, we do things like manual therapy to help reduce muscle tone and improve joint mobility that could be contributing to these headaches and the dizziness. And also things like acupuncture and dry needling are also beneficial here, either to calm a muscle down or to wake a muscle up to help out. And then the other thing we do work on is sensory motor impairment. So this is looking at things like proprioception, and what that is your awareness of your head in space. A lot of the time after injuries, this basically just doesn't work at all. So you aren't aware of where your head's sitting, or if you're turning your head, you don't know that it's there. Or even some of you might feel like your head is sitting like this all the time to the side, and you don't realize it. You might think this is upright, but it's not. So it's something we work on. And again, we work on the oculomotor control. So that's just the ability of your eyes to move around quickly without you feeling dizzy while your head is turning. And then, of course, we work on things like postural stability. And again, that's all through strengthening.
Basically, it's like the little sensors in the neck are the third piece of information that your brain gets to compare with what your eyes see and what your inner ear is telling you.
So if any one of these is not working to standard, you will experience a lot of the symptoms we've already talked about today. If you think about it, when you take your eyes out of the picture and you try to balance like that, it becomes that much harder to do. All right, let's go. Next strategy.
Number 5, psychological. Now that does not mean that it's all in your head. It means that the effects of stress, sleep disturbance, fatigue, and so on can all contribute to prolonged symptoms. So first of all, unwanted changes to somebody's lifestyle, no matter what caused the injury, but these unwanted changes such as decreased physical and social activity can have a big impact. So remember that overlapping list with the neck and concussion symptoms? It's a pretty similar list when you look at the symptoms with anxiety and mild depression, even mimicking many of the same symptoms. So this all needs to be addressed, and it starts with education and reassurance. So especially just knowing what's going on, things can be done. Half of what you hear in the media is not true. We routinely see symptom severity improve by about 50% just by helping people understand what they're going through and reassuring that they aren't broken. And that's actually large-scale research, not just what we've seen, but it's definitely what we've noticed as well. So we're going to be including our most up-to-date handout on improving sleep with post-concussion syndrome, because that's imperative to healing. That'll be part of the post-workshop package. Mindfulness and meditation routines are also very helpful for balancing the nervous system. And we'll often recommend working with a counselor who's experienced in PCS as another part of your recovery team. Is anyone in here doing mindfulness and meditation or working with a counselor?
I don't know. It's so common for everyone. And like Rob said, your life changes drastically following a concussion. So it's not uncommon to be experiencing more negative mood.
And EMDR, great.
Oh, cool.
It's beyond the scope of our presentation.
Awesome.
Good. Thank you, Brian. Good.
Awesome. So
more graphs, please.
More graphs. So those were the five things that we address